It is often recommended to eat in a calorie surplus to build muscle mass. However, this also usually comes with unwanted fat gain in the process, which is counter to the goals of many people. So do you need to bulk to build muscle, or can you build muscle while eating at maintenance or a calorie deficit? To start, we first need to understand the roles of training and nutrition in the muscle growth process. It is important to recognize that training is the stimulus for muscle growth. This is what triggers hypertrophy to occur in the first place. Without a training stimulus, there is simply no reason for the body to adapt. So first and foremost, we need to provide a sufficient stimulus to induce any muscle growth at all. Nutrition, on the other hand, can help with muscle growth, although it isn't the stimulus for growth in the first place. Nutrition can assist muscle growth by providing a more anabolic environment for the body to adapt, but it isn't what triggers growth. And one way we can assist muscle growth is via energy balance. Although, just keep in mind throughout this video that resistance training is much more important than any nutritional variable for the purposes of muscle growth. So how does energy balance influence muscle growth? Well, as far as I am aware, we don't have any good scientific research directly comparing the effects of a surplus, maintenance, and deficit on muscle growth via resistance training. However, we can use some indirect data to make some general inferences. First, let's look at the effects of a calorie surplus on muscle growth. This study compared the effects of a slower versus faster rate of weight gain on muscle growth. 39 elite athletes from multiple different sports recruited from the Norwegian Olympic Sports Centre performed resistance training 4 times per week, in addition to their regular sport practice throughout their off-season. Athletes were advised to gain weight at approximately 0.7% of body weight per week, with either assistance from a nutritional counsellor or via their own intuition, over an 8 to 12 week period depending on the length of their off-season. Both groups successfully ate in a calorie surplus over the time period for an average of around 10 weeks in both groups. However, the nutrition counselling group gained more weight, around 2.7 kilos, while the non-counselling group only gained 1.2 kilos. So the counselling group gained weight at a faster rate compared with the non-counselling group. In terms of body composition, both groups saw gains in lean mass, with the faster rate of gain achieving slightly more growth, shown in the blue. However, the fast weight gain group also gained significantly more fat mass, with the slow weight gain group gaining minimal fat. So in both cases, muscle growth was achieved with slightly greater gains with more weight gain. And overall, it definitely seems that a calorie surplus is supportive of muscle growth, but also tends to result in some fat gain too. Next, let's look at the effects of eating at approximately maintenance calories on muscle growth. There are numerous examples of trainees gaining muscle mass while eating at maintenance calories. In hypertrophy research, it is standard for nutrition to be controlled at approximately maintenance calories, and subjects tend to see significant growth more often than not. For example, this study explored the effects of a high versus low protein diet on muscle growth via resistance training. 17 aspiring female physique competitors performed the same resistance training program 4 times per week for 8 weeks. Half the subjects were instructed to consume a minimum of 2.4 grams of protein per kilogram of body weight per day, while the other half were instructed to consume no more than 1.2 grams per kilogram per day. At the end of the study, the high protein group ended up being in a slight surplus, gaining around 1 kilo of body weight, while the low protein group stayed at around maintenance, and maybe even a slight deficit, losing around 0.2 kilos. However, both groups successfully gained muscle mass and reduced body fat, despite being approximately at maintenance calories. And as expected, the high protein group experienced greater body composition changes, shown in the blue. And lastly, let's explore the effects of a calorie deficit on muscle growth, or a lack thereof. The best evidence we have on this topic is this meta-regression, which compiled the evidence on the effects of a calorie deficit on changes in muscle mass via resistance training. Overall, it was found that being in a calorie deficit tends to be less effective for building muscle compared with not being in a deficit. In other words, being at maintenance or a surplus, as shown by the diamond being towards the left-hand side of the midline. Of all the studies assessing training in a calorie deficit included in the analysis, most of them found slight decreases in lean mass, with a handful of them seeing gains in lean mass. And there also appeared to be an effect of the magnitude of the deficit. Being in an energy deficit of more than around 500 calories per day tends to result in losses of lean mass, while less than a 500 calorie deficit appears to permit further gains in lean mass. So it seems that a calorie deficit isn't as effective at promoting muscle growth compared with maintenance calories or a surplus. But it is certainly possible to build muscle in a deficit if you were taking care of other variables which influence hypertrophy, which is something we will discuss soon. But first, let's quickly summarize what the general findings are regarding energy balance and muscle growth. A calorie surplus is likely to promote the fastest rate of muscle growth. Maintenance calories will usually be viable to build significant muscle, but maybe not at as fast of a rate. And a small calorie deficit can allow muscle growth to occur, although probably at a slower rate. Although a large calorie deficit will usually result in no change or even losses of lean mass. So it seems that it is possible to achieve muscle growth in all energy balance states, but the likelihood and magnitude of growth seems to differ. Furthermore, there are many other training and nutrition variables which can mediate muscle growth in either of these energy balance states. The first is something that we have already touched on, the magnitude of the surplus or deficit. This will influence the degree of muscle growth we can expect, or lack thereof. As we discussed, a bigger surplus will likely enhance the amount of muscle we build to a small extent, compared with a smaller surplus. However, this also comes at the cost of gaining significantly more body fat too. This is counter to most people's body composition goals, and also means that we have to spend additional time in a calorie deficit to reduce this body fat later on. And as we know, a deficit probably isn't ideal for gaining muscle mass. So in most cases, a slow and prolonged surplus is usually recommended for the purposes of gaining the greatest proportion of muscle while minimizing gains in body fat. As a general rule, gaining no more than around 0.5% of body weight per week for a minimum of 6 months is probably a good starting point for most people. And the magnitude of the calorie deficit will influence changes in muscle mass too. As we have seen, a bigger deficit tends to increase the risk of muscle loss, while a smaller deficit will usually permit muscle growth, although at a slower rate compared with a surplus or maintenance. However, similar to the magnitude of the surplus, a faster rate of weight loss will get you to your goals faster, allowing more time to stay at maintenance or a surplus. So in either case, the long-term changes in muscle growth are likely to be fairly similar. Although a slower rate of weight loss is still preferred in most cases, as it usually helps with adherence to the diet and makes the process more compatible with your social, family, work, and/or study life. So as a general rule, losing weight at no more than around 1% of body weight per week is a good general starting point for most people. The next variable that will influence muscle growth in different energy balance states is your current body fat level. In general, if you are at a higher body fat, you probably have a greater chance of building muscle during maintenance calories or a deficit. This was seen in this study, which compared the effects of aerobic and/or resistance training in overweight and obese adults. 119 overweight and obese adults performed either resistance training, aerobic training, or both over an 8-month period. It was found that the aerobic only and combined training groups both lost around 1.7 kilograms each, indicating that they were in somewhat of a calorie deficit during the intervention, while the resistance training only group gained around 0.8 kilos, indicating that they were in a very slight surplus. Lean mass increased in both groups performing resistance training, but reduced slightly in the aerobic training group. Fat mass decreased in all groups, with the greatest decrease in the combined training group. So the main finding relevant for this topic is that the combined training group experienced muscle growth during a calorie deficit. However, we should also note that these were previously sedentary individuals, which may have played a role in the body composition outcomes too, as we will discuss soon. So while those with a higher body fat may have a higher likelihood of building muscle without a surplus, very lean individuals may have a decreased likelihood of muscle growth. For example, this case study followed a drug-free male bodybuilder through an 8-month contest preparation, followed by a 5-month recovery period. This subject dieted from around 85 kilograms down to around 76 kilograms at the time of their competition, before gaining weight back to baseline. Their body fat percentage started at around 14% and got down to around 5% for their competition. During this process, lean mass dropped very slightly, but increased back up after their recovery period. So at very low body fat levels, it seems to be less likely that muscle growth will occur during a calorie deficit. The next variable that will influence changes in muscle mass at different energy balance states is protein intake. It is quite clear that high protein diets are effective for building muscle mass via resistance training, and protein intake during a calorie deficit may influence the likelihood of muscle growth. For example, this study compared the effects of different daily protein intakes on body composition changes during an energy deficit. 40 untrained young men performed an exercise program 6 days per week, consisting of resistance training, aerobic training, and plyometrics. All subjects were provided with an individualized diet consisting of a 40% reduction in estimated maintenance calories. However, half the subjects consumed a high protein intake of 2.4 grams per kilogram per day, while the other half consumed a moderate protein intake of 1.2 grams per kilogram per day. After 4 weeks, both groups lost a similar amount of total body weight as expected. However, the high protein group gained around 1.2 kilos of lean mass, while the moderate protein group approximately maintained lean mass. So it appears that a high protein diet can increase the likelihood of muscle growth during a calorie deficit. The next variable which can influence muscle growth in different energy balance states is biological sex. This research review aimed to determine which variables influenced muscle mass preservation during a calorie deficit while performing resistance training. And one of the most influential variables found was biological sex. Most studies found that females are able to retain and even continue building significant muscle mass during extended periods of time in a deficit, whereas most studies find that males tend to experience slight losses in muscle tissue during a deficit. So as a general rule, females seem to have a higher likelihood of muscle growth occurring during maintenance calories or a deficit, while males are more likely to just retain or even lose muscle during the dieting process. Next, let's discuss training status, more specifically, how long someone has been lifting for and how close they are to their hypothetical genetic potential. In theory, a lifter's potential for muscle growth diminishes as training status increases. There is a hypothetical genetic limit that is thought to cap the maximum amount of muscle growth each individual can achieve. Although there is much nuance to this hypothesis, and it makes lots of assumptions about the training and nutrition behaviors of lifters throughout their training careers. So it is by no means a 100% accurate depiction of your individual muscle growth time course. Anyway, assuming this hypothesis is somewhat accurate, it would suggest that a less experienced lifter would make greater absolute gains with the same training stimulus compared with a more advanced lifter. Therefore, a greater anabolic stimulus is required for advanced lifters to experience any form of growth. This can be achieved via both training and nutrition manipulations. This is where energy balance comes into the equation. As we established earlier, a calorie surplus is generally going to be the most anabolic state. So for a more advanced lifter, a surplus may be more important to experience significant growth, whereas a less experienced lifter can probably build significant muscle mass without a surplus. Leading on from this discussion, the other major variable that will influence our ability to build muscle in different energy balance states is the training stimulus. As we mentioned at the beginning of the video, the training stimulus is the most important when it comes to building muscle mass, even more so than nutrition. So the effectiveness of our training routine will have a major influence on muscle growth outcomes. As a quick overview, muscle growth is best achieved via training in the following ways. Moderate to high volume training. This means training relevant muscle groups with at least 10 sets per week. A close proximity to failure. This means taking each set to at least around 3 reps in reserve, with the target muscle being the limiting factor of each set. Lifting with appropriate rep ranges. This means staying somewhere within the approximate 5 to 20 rep range for each set. Also, some other considerations that are relevant are selecting effective exercises, training with effective technique, implementing appropriate rest periods, and so on. So if someone trains in a way that provides a superior stimulus, they are more likely to build muscle without a surplus. Although if they train without providing a good stimulus, they are less likely to see any muscle growth without a surplus. Taking all this into consideration, let's now establish some practical recommendations. In short, it is certainly possible to achieve muscle growth without bulking. However, a calorie surplus will provide the most anabolic environment and generally results in the fastest rate of growth. Maintenance calories provide slightly less of an anabolic environment, but are still a very viable option for muscle growth. A deficit will provide the least anabolic environment, making it the energy balance state with the lowest likelihood for muscle growth to occur, and may even result in muscle loss if other variables aren't manipulated in your favor. More specifically, a faster rate of weight loss will increase the likelihood of muscle loss, while a slower rate of weight loss will increase the likelihood of muscle growth. So, for the purposes of maximizing muscular adaptations, trainees should probably aim to lose weight at an average of no more than around 1% of body weight per week. Furthermore, a faster rate of weight gain may result in slightly superior growth, but also much greater fat gain, whereas a slower rate of weight gain may slightly limit muscle growth, but will likely substantially limit fat gain. So if you want to enter an intentional surplus, trainees should probably aim to gain weight at no more than around 0.5% of body weight per week for a minimum of around 6 months. Furthermore, your current body fat seems to influence how likely it is for muscle growth to occur without a surplus. At higher levels of body fat, muscle growth seems to be more likely during a deficit or maintenance, while muscle growth is less likely during a deficit at very low body fat levels. In terms of total daily protein intake, a high protein diet will also increase the likelihood of muscle growth during a deficit, while a lower protein diet will decrease the likelihood of muscle growth during a deficit. As a general recommendation, most lifters should aim to consume at least 1.5 grams of protein per kilogram of body weight per day, or around 0.7 grams per pound per day. Females also seem to have a greater ability to retain and build muscle during a calorie deficit, while males are more likely to see losses of muscle mass. Similarly, more experienced lifters are less likely to achieve muscle growth without a deficit, while less experienced lifters have a greater likelihood. And last, and probably most important, is the training stimulus. Providing a better hypertrophic stimulus via resistance training will significantly increase your ability to build muscle without a surplus. Without a good training stimulus, significant muscle growth probably isn't going to be achieved to any meaningful extent, even with a surplus. Thanks for watching, and hopefully you got something out of this video. Check out flowhighperformance.com for online coaching, training templates, ebooks, and more.